maybe let's talk about how you feel, because you're not going to feel like enjoying time with your Valentine if you're suffering from back and neck and spine pain. But hopefully you'll be able to say goodbye to that pain sooner rather than later. Because my first guest is Dr. Anthony Leone. He's the only spine surgeon in Western New York using a robotic surgical guidance system that affords you many advantages. Now, we've been in the operating room with Dr. Leone, but it's great, Doc, that you're here to talk a little bit about this, because there's an upcoming get-together for people who would like to go and discuss this. So the nice thing, Doc, is that you always say, look, surgery is your last resort. There's a lot of ways that you'll work with people to hopefully even avoid surgery.
Yeah, that's correct. I always try to simplify the treatment pattern or protocol for patients, and Roman numeral 1 are the conservative things: physical therapy, chiropractic treatments, massage therapy, and things of that sort. Second category are injections, epidural steroid injections, selective nerve root blocks, facet injections, and things of that sort to help alleviate the back pain or the leg pain. And if you've had injections, you've been to pain management, you've tried physical therapy, chiropractic care, massage therapy, acupuncture, etc., and the injections don't work, and the pain is at a point where you feel you can't live with it any longer, then that's when you can consider surgery. And I always explain to patients that it's, in most cases, these surgeries are analogous to having a knee replacement. You're not going to die from an arthritic knee. A lot of the cases with the back, you have pain in your back, sometimes it'll radiate down your leg. Most of the conditions that you see in the everyday population, patients who have been injured at work, patients who have been in car accidents, are not things that urgently need surgery. But if all of the conservative measures fail, surgery might be their only option to having a better quality of life.
Yes, and we're going to talk about the advantages of robotic surgery if necessary, because the incision is much smaller, the pain is much less. You can pretty much take an aspirin the next day. Heavy pain meds are not necessary, and the relief is complete. It's amazing.
Yeah, we've had patients, we have some patients that you can actually listen to on our website that have had the surgery. It's still, after these months of doing these procedures, it's still difficult getting used to walking into a patient's room the day after a lumbar fusion and have them walking around the room like, nothing ever happened.
Wow.
The incisions, usually doing it the standard way, are fairly sizable and can extend, 6, 7, 8 inches, and you basically have a view of the spine just like on this model. You can see everything, so it makes it facilitates your ability to put in screws, remove bone from nerve to help eliminate nerve pain. Now you're doing it through a 3-centimeter incision.
3 centimeters.
Approximately that big. Wow. And through that incision, you can decompress the spinal cord and relieve the leg pain and remove the disc. You can, if the bones are collapsed, if the disc has shrunk and the two bones are now on top of each other, you can actually spread the bones apart, restore the disc height, put in a cage with bone graft, again through that same incision, and then you can program the robot to use that incision to put in the screws to stabilize the spine. So that one incision is the site of your instrumentation, your cages, your rods, the bone graft, the restoration of the disc height, and the decompression of the nerve.
It's amazing what can be done if you are living with back pain, and this is something that you haven't had looked at in a while. You really have to go and see Dr. Leone. We want to let you know, because a lot of questions arise because of this new procedure. Catholic Health is sponsoring a free dinner program titled Advances in Treating Back Pain is minimally invasive surgery right for you. This is coming up Tuesday, February 28th from 5:30 to 7:30 at the Millennium Hotel in Cheektowaga. Doc, you're going to be there, right?
I'm going to be there,
He's
yes.
going to be there.
Talking.
Okay. Have your neck, back, or spine pain disappear by talking to the doctor and learning about this new procedure, which is minimally invasive. It's amazing. So please get in touch with Dr. Leone and think about going to that dinner because it's for you. If you'd like to know more, call 66 Spine.